Let's see who's turning in. All right. Your body knows how to heal. And as a physician, I'm going to show you how to listen to your body. My name is Dr. Tiffany Keenan. I'm so happy to be here with you today. And what you may not have learned about medicine is that one of the things that we can be very good at is giving you prescriptions and pills to fix you when you're broken, but I'm not that kind of doctor. So, what I want to do on this channel and to be able to work with you with is to teach you the ways that you can begin to heal your body from the inside out. So, I use precision lifestyle medicine. I use data driven tools to help to work with you and develop the wisdom of your body, working with your hormones, your mindset, and your metabolism because what I know is that real healing has to address the whole person. And if we're not doing that in medicine, we're really just putting a band aid on it. So, this is what we're going to be doing here live every week. And I'll be spending more time with you talking a little bit about my pillars of health and a little bit more. So, throughout the years that I've been practicing, which is 28 years, and I studied nutrition before that time, I've learned that health optimization is about more than just blood pressure or more than just about your blood values that you see. Health optimization comes from what I see are the 8 pillars of health. And this is a framework that I've used and I've developed now with my patients over getting close to 3 decades of work. And within these health pillars, we address more than just a blood work. We address more than just a vital sign. So I want to tell you before I get into those pillars a little bit more about me and my story and how my transformation began. So I started in conventional medicine like many of us, but I had a story even before that. When I was 16, 15 years old, I actually had spinal surgery. And before that time, believe it or not, I wanted to be an astronaut. And actually, it's very timely right now because our astronauts are going to be just coming out of space very soon. And then when I had back surgery and had a steel rod put in my spine, I realized that I wasn't going to be able to be an astronaut. But I was blown away by the care I received at the Children's Hospital in Halifax, Nova Scotia. And so I said, I want to be a doctor. I want to be a surgeon. And so when I first got into medicine, I really thought that I wanted to be a surgeon. But it didn't take me long to realize that surgery wasn't for me because I didn't like operating rooms and the smells and everything else. And then I did do my background in nutrition because I always had a special interest as well in overall health. And I felt that nutrition was great because it was going to serve me in medicine or whatever else I did in my health. So then once I got into medical school and realized orthopedics wasn't for me, I said family medicine is going to be my route that I really wanted to go in. And so through the years, I expanded on family medicine. I spent time working in the emergency department. I spent time working in public health. I developed a medical clinic in Haiti and really learned about the fundamentals of health. And I think the years that I was in Haiti really taught me that because there wasn't a lot of fancy medications, a lot of fancy healthcare, but we could still keep people healthy when we looked at the fundamentals and the roots of health. And then as time passed, I actually fell into something called functional medicine. And this is really where I met my tribe of people. I met a group of doctors that knew that there was something more than just blood work on a sheet of paper. It was more than just giving a prescription to try to heal someone. And that so resonated with me. And it's been almost 10 years that I've really been practicing functional medicine, which is basically a root based approach to health. And really, it's personalizing healthcare to you. And then over the past 5 years, we've had a lot more data driven tools that we've been able to look at to address health above and beyond any kind of blood test that you'll get at your family physician's office. So, through this time and these years of medicine, I realized that both for myself, as a physician and learning to navigate my own health issues, and the patients that come in to see me, that we have to look outside of the boxes. And in Western medicine, this is what we're being taught. And even to this day, we have a format that we label everything as a disease, and then we look at a treatment for that disease. So we don't look at the body as a system, and we don't look at the body as a whole, and in this form of wholeness. And really, this is what I have begun to do through the years. And it's this system of seeing the body as a whole that I think gives my patients the results that they're getting. But also, it's worked for me too. And as a 54-year-old female, when I started on my journey of health and wellness, so nutrition was fundamental, stress management was fundamental. But when I was 41, I actually started developing symptoms of stress and anxiety that I didn't know what they were. I look back now and I realize that was perimenopause, that it was beginning for me. And so through the years, I've actually, again, really did a deep dive into what's going on with my body with the hormonal changes. Because one of the things that you need to know is conventional doctors, we are not trained in this, right? So I went into my health journey. I learned about menopause. I learned about gut health because I needed to heal my gut after I had my gallbladder taken out. And with my hormones, I knew that the doctors and the specialists that I went to see from a conventional front, they still weren't offering me what I needed. And so I took a deeper dive and a deeper dive. And so this is where I am today. And it's this my own personal journey that's really been able to help me in my understanding of what women go through, the stresses of life, what it means to work on our health from a root cause approach. And I know that when we miss those root causes of health, that we're just band-aiding things. And even when it comes to hormones, and I want to put this out here, even as I start today, that many times I think with what's happening now with social media, HRT and hormones are also being thrown at a lot of women. And this can be overwhelming for some because everyone's being told you need to optimize your hormones. But guess what? There's so many other things that need to be optimized. It's not just an estrogen report. It's not just an estrogen blood level or a testosterone blood level. We have to look at the body as a system. So, what is the system that I use? So, I have an 8 pillars approach that I use with women and with men because I still have those in my practice and I still do community work as well. But the 8 pillars are these. We have to look at the fundamentals, the way that we breathe, the way we eat, the way we move, and the way we sleep. So this is the hardcore of healthcare. And so many times these things are not addressed in health, even starting with the breath, the most fundamental. And then we move on to those pillars of kind of getting beyond the body and looking a little bit deeper into our beliefs. So, the way that we believe, what we believe, the way we speak to ourselves, the way we speak to others, the way we restore our body and our mind, and the way that we connect. And throughout all of those pillars, what we begin to see is that there's connections. And also, I've learned that there's a development, that everyone doesn't get to all those pillars all at one time. That's a stepwise approach. And so I really believe that we need to meet people where they're at. As physicians, we're trained in so many things. And often I even think for me now that my brain, it has so many details inside, but I can see a 24-year-old who is on a very early level of her journey, or maybe I see a 65-year-old who is also at a different time in her life and a different level of her journey. Both of those individuals as well, they have may have different degrees of education. And I'm not talking about their advanced education, but some people actually understand their body more than others. And one of the tools that I like to begin with is body awareness. And I really say it's so important to know thyself. Because if you don't know yourself, then how can you begin to treat yourself or to really know what's going on? And this is where I like to use data driven tools and also things like mindfulness and breath work, because those are great ways to connect to ourselves on a very different level. And so when we begin with that, when we begin with awareness of the body, with awareness of knowing who am I, what's going on with me, and then we can work on the physical vessel, then we can also work on our emotional and our spiritual needs to see what is going on with me. What do I need to do next? So, as we work on all those pillars from the breath to connection, one of the things that I've done is develop a way that we can all connect. And the way that we do this is through true connection. Okay. So I do this in person with groups in the area where I live here in Eastern Canada, but I also do this on my membership platform. And so I created this community. And what it does, it takes all of the conventional models that I've used and I teach women these methods that go beyond convention into the mind, into the body, into the data to allow women to take their health back. I want to empower you. No one is ever going to know your body as good as you will. And if you think that someone is going to have the answers outside you, then you're wrong. You need to learn how to have the answers with inside yourself. And within this community, I've made it intentionally very low cost because I know that a lot of individuals can't afford to have a $500 consultation with a hormonal specialist like myself. And so within this framework, you have insight to my 8 pillars along this journey. And then over the course of month over month, we began to chip away. So we work at those 8 pillars. So it doesn't really matter where you enter along this journey because we all know that there's a lot of work to do. And also within the network, you have access to the past videos and you can watch replays so you can see where we are on those pillars and then you can begin to step in. And I also believe in giving actionable insights because you need to do the work. And, through the years, so many times people come and they really want it to be done for them. We're all looking for the magic pill. But if you want optimal health and wellness, there is no magic pill that you will find. It takes time, it takes dedication, and it takes discipline. So, if you're willing to join me, I'm going to pin the link for the membership here in the chat. And I would love to see you join us on Tuesday nights. And that's when the membership platform opens every Tuesday from 7 to 8 p.m. So, next week, what we're going to be diving into here, and I'm going to share some of the insight from these pillars within this YouTube live. I'm also going to have sometimes some special guests that are going to give a little bit of extra insight into the pillars. But next week we're going to be diving into the topic of fasting. If there's one thing that we can do for our body, it's not always doing more, it can be doing less. And this is what fasting is. When we remove food, we can actually help our body to heal from the inside out. So, if you want to hear more about me and the work that I'm doing, please stay tuned. So, the way that works here on YouTube, if you subscribe to my channel, it's going to give you a notification when I go live, which is going to be every Friday. So, please hit that button and also feel free to go back and access a lot of the videos that I've posted before. There's a lot of content here. So, my goal for you is that I am going to be giving you information that you can use, actionable points in your everyday life, so that you can know that there's a doctor that's willing to be here to listen. And I'm going to be a doctor that's going to be here to teach you how you can heal from the inside out. Stay tuned. Bye for now, and I'll see you next time.